At Dr. Sellars Educate, we help nurse educators and leaders advance their skills, pass the certification exam, and achieve excellence in nursing. Whether you're preparing for the CNE, CHSE, or CNML exam, our coaching programs, masterclasses, and study resources are designed to help you succeed with confidence. We provide a NCC-accredited continuing education, faculty development workshops, and practical strategies to strengthen teaching excellence, simulation, curriculum design, and accreditation readiness. We partner with schools of nursing and healthcare organizations to support faculty development, certification initiatives, accreditation preparation, and educational excellence. More than 5,000 educators have trusted Dr. Sellars Educate to support their professional growth and certification journey. Visit us to learn more and join a community committed to excellence.
Some of your highest scoring students in the classroom are making the biggest mistakes in the clinical setting. And what we're seeing more and more is that it's not about what students are not able to do. We know they get to the clinical setting and they're not able to prioritize. It's more of what you may be missing when it comes to helping students really have that deeper understanding of the rationale for their clinical decision making, not just the action, but also the why. Welcome back, everybody, to Dr. Sellars Educate, where our mission is to support all nurses, all nurse educators on the journey to achieve excellence. Some of you may be on the journey to achieve your certification as a nurse educator, or maybe your certification as a simulation specialist, or some of you may be on the journey just to become a better nurse or a better nurse educator. Make sure first and foremost that you go ahead and print out the study worksheet. We're going to be using that to really talk through our conversation today. And then the second step we want you to take is to pull out Billings and Halstead. We're going to go ahead and give you the reference before we even jump into our content. We want you to take a look, and this is the 6th edition, by the way, but if you have the 7th edition, that's great too. Effective Clinical Teaching. This is going to start on page 336 and go through page 338. Patricia Benner told us many years ago in her Educating Nurses book that it's important for us to not wait until students get into the clinical setting to really teach them about application, to teach them the importance of understanding the rationale and just thinking through those questions that they want to consider before they make a clinical decision. The next step we want you to take is to write down today's date, whatever date you're watching this snapshot. We're going to have a deeper exploration of what it means to really engage students on this clinical judgment pathway to help them have that deeper understanding and ultimately make safer patient care decisions. Just yesterday, there was a physician that was discussing during our Quality Improvement Committee meeting. He was discussing the fact that a parameter for a systolic blood pressure was not written for a beta blocker. And the nurse decided to give them medication, even though the parameters that systolic blood pressure was lower than it should have been. As a nurse and as a nurse educator, this is exactly what we want to have a deeper understanding about. Even though there were no orders written to hold if a systolic blood pressure was a certain number, there's still an expectation that we as nurses are able to make those decisions based on the type of medication. We know with the beta blocker, it's going to lower their blood pressure. It's going to lower their heart rate. And it's important for us to know what those numbers are before we give a medication. When we talk about clinical reasoning and clinical judgment, that's exactly what we mean. The ability to truly understand what happens to the body when we give a medication is a critical step. And as a nurse educator, that's what we want you to consider. We talk a lot about thinking like a nurse. Well, we want you to start thinking like a nurse educator. What are some of these strategies that I am going to collaborate with my students about to ensure they have a deeper understanding about what their clinical practice decisions are, and then also why they're making that practice decision? All right, and before we get too deep into our content, we want you to go ahead and pull out Rooted in Wisdom if you have it. If not, that's okay. We're actually going to share our screen and talk through this really important devotional today because we want you to have a deeper understanding of what it all means to become an excellent nurse educator and to get just 1% better every day. Part of that could be, if you're like me, being able to draw from your understanding and your discipline associated with our profession. We know that in nursing education, we are expected to have a higher level of understanding because we want to be able to facilitate conversations with our students to help them improve their clinical decision making. So, in today's conversation, we are going to talk about failure, what it is and what it is not. Okay. So, I'm going to go ahead and share my screen. Failure is not opposite of success, it is the part of the journey toward it. Every mistake is an opportunity for growth. As educators, we must model resilience and demonstrate that learning continues even in the face of setbacks. And that's exactly what we have to remember as a nurse educator. Our students are not going to always get it right. That's why they're called students, because they're on this learning journey. And we want to support them in moving forward as they think about what their next steps are going to be on their path. All right, so this is the question. Why is it that our smart nursing students still struggle with clinical judgment? Now, I want you to reflect on that question and go ahead and write down what you think, maybe just 2 points you believe based on your current practice could help our smart nursing students, and that's defined as a student who shows up in the academic setting and does really well on exams, has great conversations, maybe even with us. And then when they get to the clinical setting, they're not able to prioritize. They're not able to make those safe patient care decisions. So go ahead and take a second and write down just 2 components of the learning journey that you think can be a hindrance to students' ability to really transfer that knowledge into application. And then we're going to talk through 3 key strategies that you want to consider to help students move through this learning journey, help the student transfer their knowledge in the clinical setting in the same way they are able to select the correct exam question. All right, so hopefully you've had a chance to write down maybe just 2 examples or 2 opportunities for you to help students move through this learning journey so that they can transfer that knowledge and that skill. And then maybe you're thinking too about some additional teaching strategies that you can use in the classroom. All right, so here's our thought-provoking question. Let's see what you think. A nurse educator notices that students consistently identify the correct disease process, but select interventions that place the patient at greater risk. Which teaching strategy is most likely to improve clinical judgment? We have A, increase the number of content lectures covering disease processes with quiz questions. B, require students to justify why each intervention is the safest option based on patient priorities. Or C, assign additional articles for students to review current clinical practices. All right, so take a second and think about not only the correct answer, but we also want you to think about the rationale for the incorrect answer. When you get to the CNE exam, there will be 3 options. We want you to think about, first of all, what is this question really asking me? The second question we want you to consider is, what is it that I know about content that is included in this question? All right, so I'll give you a second to think through those steps in the process. And then we'll look at 3 key areas you want to focus on as you start to think about what your next step is going to be to help our students give safer patient care. Because as we all know, we could be the one on the other side of that student years from now after that student graduates, receiving care from that student. And we don't want to have palpitations when we look up and see a nursing student from our class. We want to feel confident that they're going to give us great care. All right, so if you chose B, you are correct. Round of applause. Clinical judgment develops when learners analyze competing priorities, defend their decisions, and connect evidence with patient outcomes rather than simply recalling information. When you look at the cognitive learning domain, the 3 learning domains are in the 6th edition, pages 188 through 190. We know that lowest level is remembering or recall. And the value of helping students really be able to make those safe patient care decisions is aligned with our ability to scaffold or build on prior learning. So how do we do that? We make sure that we develop that exam blueprint as the first step in developing that valid and reliable exam so we can feel confident that the questions that students are answering on the exam are aligned with the safest patient care, and also that we are challenging them as we build on their prior knowledge. So we don't want all of the exam questions to be at that lowest level. We want to have some challenging questions. And this is why when we look at alignment with the levels on the cognitive learning domain, the taxonomy. We want to be clear about where they line up. Just like with our learning objectives, we don't want 80% of our learning objectives to be at those lower levels. We want to be able to really engage in difficult decision-making processes with our students so they're able to make safer patient care decisions at the bedside. And then A was incorrect because additional content may improve knowledge, but it still doesn't push that student to that level of prioritization so they can determine why they're making those clinical decisions and what steps they should take first, second, and third. And then C is incorrect because, again, additional reading does not expand knowledge. We want students to have a chance to practice those skills, give them feedback, and then be able to move forward. All right, so here are 3 key steps you want to consider to help students move to that higher level of knowledge and application. Being able to marry the two is our goal. So number 1, content knowledge does not equal clinical judgment. Even our brightest, most smart nursing student is going to struggle at times when it comes to the clinical setting. We want to help our students be able to think, process the information about the action steps they're going to take, even when they're under pressure, even when it's a complex healthcare situation. You have family members at the bedside. It can start to feel very intimidating. We want students to have that emotional intelligence, helping them, supporting them, and talking through specific unfolding case studies that are similar to the ones that they're seeing in the clinical setting is a way for students to feel not only more competent in developing their clinical judgment making decisions, but also more confident. So we want competency and we want confidence. All right, so what kind of questions can you ask when we think about content knowledge, or what approach can you use? We talked about unfolding case studies. I want you to go ahead and write down a couple more. So what are some other strategies you can use to help students really move past that basic understanding of knowledge to get to those mid to upper levels where they're analyzing and they're applying the decisions that they make? So let's talk about one example. So unfolding case studies is one. Another example we can use is role playing. So students actually being in that patient position, that family position, or even the nurse, because they're going to receive support from us to be able to make those decisions. Students may know the disease, but they may still struggle with prioritizing and having an understanding of what's going to happen to that patient's body. And oftentimes, our patients also are going to have questions. And so we just want to be able to help students work through those struggle points that they may experience. Developing critical thinking beyond memorization. These are all of the strategies as we're talking through some of those hands-on experiences. Those are the ones that are going to help students really be able to move beyond just the basic understanding of knowledge. Clinical judgment must be practiced. We know that for sure when we think about the pandemic and students having limited in-person, hands-on experiences. We know that there was some learning loss that happened. We know that some students, especially our kinesthetic learners, really struggled during that time. Repetition is important. And also another really important part when we talk about clinical practice is feedback from faculty, and also students having that increased self-awareness, engaging in reflection journals, engaging in reflective practice strategies really help students put those puzzle pieces together. And we can start that in the classroom. A good example is going to be asking students to develop those unfolding case studies for themselves. And then the other layer that we can add to that is when we're able to actually bring in a sterile kit or some type of hands-on clinical device where students can actually not only talk about the steps they would take, but they're actually able to demonstrate them. That doesn't only happen in the skills lab, that should also happen in our didactic setting. All right, so then some other steps we can take as students are talking about what their steps would be, even in the classroom, as they start to formulate their ideas about, say, patient care. I'm gonna come off full screen for a second, just so we can have a conversation. I know that even with our students in the classroom, when we don't mix it up from time to time, students can start to drift. Their mind can start to wander. So our ability to kind of mix it up a little bit does help them refocus, helps them reconnect with the conversation that we're having. So when we think about engaging students in these conversations to help them develop clinical judgment, we want to think about asking open-ended questions. So it could be, what is the priority in this situation? And students can say, okay, I noticed that this patient had some discoloring of their skin on their leg where they had surgery. Okay, great. So you notice they had some discoloration. What are you going to do next? Okay, so just helping students thinking through what the priorities are going to be based on the presenting information that they have. Thinking about another open-ended question, it could be, why is this the safest choice? Students really having that moment to deeply process why this is the safest choice. As an example, perhaps they decide to check the patient's temperature. Maybe they decide to, if the orders warrant this to be appropriate, maybe they take a look at the actual wound site to see if there's any drainage, if the drainage color has changed. And then another question they could ask themselves, or we could ask them, what could happen if you chose another option? I really like that one. What could happen if you chose another option? When it comes to wound care, we know that patients can become septic really quickly when it comes to a wound that doesn't heal. So these are just some questions that can help our students develop that deeper understanding related to patient care, related to a disease process, so that they can not only make the right decision in that example, but also that they make it the right decision the next time. All right, and then that last concept I want you to remember is that every exam question should teach clinical judgment. What do we know about smart students? They have a strong memory, they have a history of academic success, and oftentimes they have really good test taking skills. However, when it comes to the clinical demands, it requires situational awareness and real time decisions. They have to engage in emotional resilience, even under pressure, and be able to communicate and utilize adaptive thinking. When we're engaging in these conversations with our students, it's essential for us to think like a nurse. So, what could that look like? Considering additional teaching strategies that are going to allow students to have these hands on experiences, asking students to think about why the choice they're making is safest. Because hopefully, we're able to help them dig deeper to have that understanding we need for them to have about their decision making. And then we want them to also think about, even for these exam questions, why are the distractors incorrect? Just like we did earlier, we want students to understand why those other options are not safe or not the best decision to make for that patient. Judgment comes not from knowledge alone, but from experience, reflection, and courage. If you want students to truly think like a nurse, we have to engage them in conversation, engage them in those hands on experiences in a practice environment, giving them feedback, allowing them to make corrections so that they can apply those skills at the bedside. Creating these situations in a low risk environment really is the best strategy to help our students have that confidence, and we're able to validate competency as well. CNE in 60 days is a journey that so many colleagues have gone on to help them have more structure and be able to focus with a supportive community to achieve success. If you're ready to move forward on your CNE journey, we look forward to seeing you in our next CNE in 60 days. And if you're a colleague that is just showing up to become a better nurse educator, we're delighted that you are here as well. At Dr. Sellars Educate, our mission is to not only support you through a program, but also support you until you achieve success. We hope this snapshot has been helpful and will improve your ability to engage your students in those safe patient care decisions, because our community deserves it. We look forward to seeing you in the next snapshot. Have a great one, everybody.